When you come home from the hospital, you're going to have some aches and pains. And gradually that wears away, but you never get really, for the first few weeks, you really don't have the feeling that you're whole, that this is your hip. You feel like there is something there that's not quite right. About 2 months into it, maybe a month and a half into it, it was, why didn't I do this before? I don't notice any difference between what I had before with my natural hip when it was good and what I have now with these replacement hips. And both of my hip surgeries have been that way. I had therapy for both, after surgery therapy for both hips, and I believe that that helped me a lot. But halfway through the therapy, which was only a couple weeks, 6 weeks long at the most maybe, both of those, I think, I felt like this is my hip. This is my joint now. It's not something that somebody else put into me. This feels no different than when I was a 16-year-old kid. I can bend, I can move, I can do it. Well, I can't dunk the basketball anymore, but I'm 58 years old. But I can do a lot of other things that I haven't been able to do for a long time.
Without surgery to replace Ted's joints, he would have been pretty significantly handicapped, not only with his normal activities of daily living, with the pain that it causes and the stiffness, but it would have affected his golf game significantly. People with bad hips particularly can't hit the ball straight, and they do so much compensating for their bad hips that they don't know where the ball's going.
The one way that I saw that I could thank Dr. Kepley was I knew that my handicap had been going up over the years. And I knew it was because of the lack of motion and the pain in my hips. So I went back and I looked for several years of my own handicaps. And I noticed that there was an upward trend in my handicaps until the surgeries. And then it dropped right back down to where I had been playing the type of golf I'd been playing before. And I credit all that to what these new hips of mine.
When people begin to experience joint problems, and when it starts to affect their quality of life, that's when we would really like to see them. The timing of the surgery is extremely important in terms of how hard or easy the recovery is going to be. So people that time their joint replacement surgery, whether it's for a hip replacement or a knee replacement, will do better if they can get to us before the joint has a chance to significantly stiffen and the muscles have a chance to significantly atrophy and weaken.
I have one regret really for probably all three of my surgeries is, why didn't I do this before? Why didn't, when I thought the first hip was sciatica, why didn't I have it checked out before? Why did I go a year or so in this pain and numbness going down my leg? Why didn't I get it checked out, find out what was really causing it, and get it fixed? In your 50s, if something's going to last you 20, 30 years, why not get it replaced? And so why didn't I do this before? Why did I wait so long? That's the only regret I really have.
The advantages of doing this type of elective joint replacement surgery at the Crystal Clinic Orthopedic Center has a whole lot to do with it being a single specialty orthopedic hospital. We essentially treat patients for hip and knee joint problems and other elective orthopedic procedures, and we're not faced with treating patients with infection problems. This allows us to insulate the patients from infection risks that you would deal with at other all-purpose general type hospitals. We also have a very specialized staff who deals in just what we do. We have our own therapists, our own surgical personnel, our own floor recovery people, as well as recovery room people. So everything we do at the Crystal Clinic Orthopedic Center is subspecialized exclusively to what we do.